In today's Eye on Health, we are talking about delivering the right care at the right place and at the right time for each individual patient.
And that means making medical care convenient. And to do that, AHN is partnering with community EMS providers to provide care right in the patient's home.
Yeah, and here to tell us about this new approach are Dr. Thomas Campbell, the chair of emergency medicine for Allegheny Health Network, along with Bob McCowan, the vice president of pre-hospital care services, and a patient who received that life-saving care, Christine Holt. Welcome to all of you.
Thank you.
Morning.
Yeah. So good to have you here. And let's talk about bringing this, because it sounds so simple. I mean, it really does, because sometimes these EMS workers are the first ones to see these patients before they get to the ER.
Right. So our philosophy is to get the people the right care at the right place, the right time, and to sort of revolve things from being hospital-centered to being patient-centered, and to make it more convenient for people to get the best health care that they can. And sometimes, unfortunately, that's when you have an emergency. And so looking at that care from the time you're at home all the way to the hospital has been our newest effort in partnering with our pre-hospital care personnel to deliver that care. So we've really sort of spun it around altogether and focused on that.
On the patients.
And in some cases, people may not even have to go to the emergency room anymore through the use of technology, right?
Absolutely.
That's correct. So at Allegheny Health Network, again, to Dr. Campbell's point, we partner considerably with our EMS provider partners in the field. And care truly does begin in the home, at the accident scene, or in the workplace when EMS arrives and starts rendering that care. And that care progresses through transport to the hospital because they are communicating with the physician regarding medical direction and so forth if there's any challenges or questions or whatever. But they are strong partners with us, and quite frankly, the true link to the community in providing that care.
Well, and Christine, unbeknownst to you, that's exactly what was happening in your case.
Yes.
Can you share your story with us?
Yes, it was almost 4 years ago whenever I was test riding a horse. I was considering to ride it, and I got thrown and it kicked my head on the way down. So I was life flighted to Allegheny General Hospital, and they rushed me in for emergency surgery for my brain injury, and then I went to rehab for a month. And as they were wheeling me into the rehab, I didn't even question why I was being wheeled in, because I was in a wheelchair at that time, and that's where my brain was at that point. It's like, why is everybody here? Why is it?
Why am I here?
Yeah,
right?
why? I didn't even question that, but as my brain started to heal, I started hearing the stories of what had happened, and I had this feeling where I just needed to start to write. So I started writing. I wrote a book about this. I wrote about how I went back to meet everybody involved with my care, because I found out the life flight, it was 16 minutes.
Wow.
And I found out later, 5 minutes later, I wouldn't have made it.
So, but it really was all about communication and everybody being in contact and working together to get you the care you needed.
I went back and I met everybody. I started from the 911 call. What did the Butler ambulance know? What did they communicate with the life flight nurses? What did they communicate with Allegheny General? That itself was quite the journey to go back and meet everybody and thank them and know how everything worked together so well.
The communication and also the amount of time, like it's remarkable. Minutes make a difference in that situation.
Right.
And I know one of the things that you all want to do with Allegheny Health Network is have more community-based hospitals, correct? And that's one of the things we want to talk about today. For instance, Jefferson Hospital, big expansion there, right?
Absolutely. It was $20 million expansion to Jefferson Emergency Department, doubled the square foot of space, and the treatment areas from about 37 to 49 treatment areas, and the community needed it. And so not just in life and death emergencies, but for routine emergencies, if you can call them routine emergencies, we want to make the care more convenient, even when you have to use the big hospitals. But you mentioned one of our other goals is to try and keep the patient care in the communities, and that's the neighborhood hospitals that we're developing to build that will be available by the end of the year. At Hempfield will be our first one in mid-November, and followed a month later at Baldwin as well as McCandless, and then a little bit later than that at Harmer. And these hospitals are just small footprint hospitals with full-fledged emergency departments as well as 10 inpatient beds. So if people do have to stay and don't need high-level care that the big hospitals do, then we can keep them in their community and they won't have to travel.
Well, I know if you're feeling sick, I mean, if it's a true emergency, you're arriving by ambulance. If you're taking yourself, sometimes there's that hesitation. Do I really need to go? And I think I've been in this situation before. I don't want to sit in the emergency room waiting to see a doctor. And the times have gone down at a lot of the hospitals.
Absolutely. We've seen our wait times at our emergency departments go over the past 3 years from about 35 minutes on average to about 15. So it's really improved. And as you pointed out, there are some choices now we're giving our patients, but it can be confusing. So we've also developed a Nurse for You call line that is available 24/7, so nurses can help you. If you don't have an emergency, they can even make an appointment for you the same day, next day, or direct you to an urgent care center, or if they believe your symptoms are severe enough, go to an emergency department and increase the communication. They'll let me know you're coming.
Just having the guidance for that is wonderful.
Yeah,
so.
sometimes you just need to ask a couple questions before you go.
Right.
Thanks so much. We want to thank Dr. Campbell, Bob, and Christine for being with us today, and our thanks to Highmark Blue Cross and Blue Shield, together with Allegheny Health Network as well, for sponsoring Eye on Health. Watch for it every other Wednesday here on PTL.